questions during the week, please use the Q&A on your Zoom link. And if you're joining us from our Facebook Live, please use the comments feature or direct message us any questions you have. Now I'm going to introduce you to our fantastic panelists. So first of all, we have Irene Prasad, who is a project manager from our Save the Children Fiji, who has been heavily involved with the education cluster and COVID-19 emergency response plan. So we're very proud to have her here tonight with us. We also have our Save the Children New Zealand Chief Executive, Heidi Coetzee, and we're very grateful, Heidi, for your dedication to this cause and for joining us tonight. Shairana Ali, the Chief Executive of Save the Children Fiji, who has been leading the incredible work that Fiji has been doing on the ground in Fiji. And finally, we have Lice Movono from Today Media Fiji, who is our host and the Fiji correspondent for Radio New Zealand, ABC, and many other media organisations, and has been sharing all the news from Fiji most days. So I'm going to switch my screen off and hand you over to Lice, who will look after you. I've asked her to start by giving us an update on the current situation in Fiji and how it has been for her reporting on this emergency. Thank you so much, Lice.
Vinaka, Amy, and Bulavina, to everyone of you listening in tonight. Thank you so much for your time. Thank you for your generosity. Thank you also for your interest in being part of the Feed Fiji campaign, such important work that the people over at Save the Children here in Fiji, and of course with their partners in New Zealand, helping to make sure that our children don't go hungry, that food goes to their families. I'd like to first of all thank the people at Save the Children New Zealand and my colleagues over at Radio New Zealand for this opportunity to be able to be part of a talanoa that is very important, and that is of course geared at telling you, our viewers, our friends, our family, about what is happening on the ground, what the situation actually is with our food shortage crisis, and of course the important work being done to address that situation. And as Amy had mentioned, I am going to start off by giving you the lay of the land insofar as the COVID-19 situation here in Fiji is, as well as a little bit about the response, but maybe to tell you a little bit more about what I do in terms of the COVID-19 coverage here in Fiji as a way of leading into why this conversation is very important. So as Amy alluded to, I am an independent journalist. I work for Radio New Zealand out of the Pacific team based in Auckland, and I also do some work for ABC in Australia and a few other people who are interested in what's happening here in Fiji and in the region. I've been covering the COVID-19 pandemic since it began in Wuhan in China at the end of 2019 with the ABC team paying close attention to the impact that it would have here in Fiji, given our very close flights to mainland China and of course our political relationships. It was from then on that we've started to pay attention as a news community here in Fiji to what the situation could turn out to be. Fast forward a year and a half later, we're at worst case scenario. We're in a situation where today we've recorded our first ever case outside of Viti Levu, the main island, and Vanoi Levu, the second largest island in Fiji. We've had this afternoon a case in Kandavu. We've had for the past I think close to 4.5 months, more than 41,000 infections here in Fiji. And of course, as I'm sure our people here can tell you, we've had a lot more deaths than anyone can avoid. Every single one of us here in this country has had a close contact with COVID-19, whether we've been infected ourselves or know people who have, or have had the misfortune of losing people to this virus. But as per April as per August 19th, we've had 369 deaths by COVID, 371 in total just from this outbreak. 3 of the people who have passed from this virus have been children, 2 of them 15-year-old and 1 below the age of 1. So children have been very much a part of those affected by the pandemic here. But on a larger scale, the silent pandemic, the quieter impact of this virus is one of a humanitarian nature. It's about families not having food. It's about parents not having jobs or any forms of income to be able to put food on the table for their children. And so it's so important to be able to hear the stories of organizations like Save the Children Fiji and to see the work that their partners across the Pacific in New Zealand to be able to work together to be able to address that issue. And so right now we can say, I can confidently say that we have not yet seen any progress in the response to this pandemic. We have seen a drop in cases, and that's been apparent over the past 2 weeks, but as you will know from the updates from the Ministry of Health, we have not yet seen progress. We continue to see a lot of deaths. We continue to see a lot of infections in those divisions where contact tracing, where community surveillance continues. As you know, here in the Suva area, we are no longer community surveilling or contact tracing. And so you will expect to see a drop of cases, but please remember that as long as we have deaths, we must continue to observe the government's COVID-19 safe protocols. Now, enough about the situation and just a grateful note from me to be part of this conversation, just to be able to facilitate the flow of really important information to you about the work of Save the Children Funds. So without further ado, I am going to first thank the team in New Zealand and our families in New Zealand. You're in day 2 of your own experience with the Delta variant. And so we're grateful that even at this juncture, you're part of the work to help feed Fiji and help put food on the tables in the families of Fiji's children. So Vinaka Vakalevu, Vinaka Amy, and Vinaka to the tech team that are supporting us. And I would just like to remind everybody as to the donate link that should be showing up on your screen right now, and also ask Shairana to join us and to please begin the conversation to tell us about the work they've been doing, the tireless work they've been doing to provide relief for children in this crisis. Vinaka Shairana.
Bula Vinaka Lide and Bula Vinaka Kia ora to everyone that has tuned in this evening. Thank you so much for this opportunity to our colleagues at Save the Children New Zealand. And as Lide, as you rightly mentioned, you know, the situation in Fiji is extremely dire at the moment. And since we had our first, case back in April, we Save the Children Fiji. We, as you know, we are a humanitarian organization. We are a child rights organization, and it is one of our core commitments is to respond during any type of crisis that occurs in the country. And so we started responding to the needs on the ground immediately after the first, outbreak. And since then, we've been inundated with requests from families just asking for assistance, asking us to provide support in terms of providing, grocery packs, just helping out with, the needs from the infants, the babies. And so we have been responding for the past several months, just helping out families. We've received requests through our Facebook page. And so far we have assisted more than, I believe, 1,000 families. But having said that, we still have many families that are, in need. We've got over 1,000 requests that our team, are attending to at the moment. The team is out in the field. Our staff who are, working pretty much every day, distributing grocery packs. And this has been made possible with the support of the New Zealand public and the funds that they have donated to the appeal that has been put up. So we are very thankful for that. But the need is there still, and will be there for the next several months.
Thank you, Shairana. I understand that the government has distributed about $5 million worth of food bags, and I bring that up by way of trying to look at the magnitude of the situation here. But tell me, how you mentioned 1,000. How many families do you think that you need? How many children do you think are vulnerable at this point and at risk of going hungry? Or maybe tell us that, and tell us how many have you been able to reach so far?
So at the moment, we know there is assistance from the government. However, the assistance is quite, it depends on the areas and the locations the government is able to reach. So Save the Children, we are complementing the efforts of the government, and so are other civil society organizations. So if I just go back to the request that we have received over the past several months, there are, over, like I said, over 2,000 families that have reached out to Save the Children Fiji directly. And, if I look at the number of children, we are looking at more than probably 4,000 children in total who are in need at the moment. And of course, these numbers will likely increase in the next few weeks and months if the COVID, outbreak in the Northern Division and in Maritime Islands is not brought under control, right? So we're expecting these numbers to go up as well.
Shairana, that is just on Viti level alone, am I right? Can you tell us now with news that Kandavu has had a case and Vonolevu at Nambuwalu has had their lockdown, how worried are you in terms of the increase in the number of families with children that will require your help?
Yeah, like I mentioned, the situation is, quite dire right now. We can, based on the situation in the Central Division and the Western Division, and, just as I stated, we have 4,000 children that are in need on the main island of Viti level. But these numbers will go up if the outbreak in, say, Kandavu or Vanuatu is not brought under control. So there would be many, many more families that will have to stay at home. I assume that non-essential businesses will have to be closed, and I understand that some of the businesses have closed in the Northern Division already. So that will have an impact on people's income and their ability to earn it. So I expect that these numbers will go up in the next few weeks as well, the number of families that will be asking for assistance.
Tell us about some of the families you.
So I think I shared a story of one of the mothers who had had difficulty providing for her newborn, and she was feeding her baby sugar and water. And we were able to reach out to her and provide milk and food items to carry her through. So yesterday she reached out again because she had run out of milk for her baby. So we have attended to that today. And so I think, the funds that has been contributed by the New Zealand public has been really helpful in meeting such needs of, families. We've also had another family member who reached out. She's looking after adopted children. And she had basically, nothing left in her house to feed the children. So we were able to attend to that. So there are so many other stories that we are hearing on a daily basis. They're just families that are really, struggling at this point and are not able to provide, or they have really no assurance about where their next meal will come from.
Sharon, I just want to say bless you for continuing to reach out to that newborn mom. I can't imagine the kind of situation they were in to be feeding their newborn baby water and sugar. And you continue to attend to her needs. So that means your staff must be working very closely with some of these families and continuing to track their needs. How are your staff doing in terms of just the public health risk, also maybe the mental impact of just being in the middle of so much need right now?
Yeah, thank you for asking that question, Lide. And actually, we've been really fortunate that so far our staff are safe. Most of our staff are safe and well, and we've had to implement really strict COVID safety protocols to ensure that our staff are well while they are distributing these packs in the communities. So we've actually had to move staff away from their families as well, which is extremely challenging. They have been away from their families, they are accommodated elsewhere so that they don't contract the virus and take it back to their families. So we were very conscious of that. We've had most of our staff who are vaccinated or are fully vaccinated as well. So that has really, been a plus point in terms of, being able to continue the work that we are doing. So obviously, there are challenges. We provide PPEs to our staff to make sure that, they are keeping safe while they are out. And we have strict guidelines. So we follow the guidelines from the National Disaster Management Office. And we ensure that we don't have any physical contact with the families that we are reaching out to. So we make sure that we are maintaining a distance and things like that. That has really protected our staff. But in terms of, you also asked about, mental health. And I think, everywhere, this is a similar story. And I think, it's being shared by various organizations, just keeping that morale up and keeping staff motivated. I think, just our mandate and the mission and the vision that we have to protect children and make sure that we are reaching vulnerable children, especially during crisis. That mandate, the beautiful mandate that we have is really, being a morale booster for staff, and staff are committed to the cause of saving children during this difficult time.
Shairana, as you mentioned, you work closely with the NDMO, or the National Disaster Management Office, and you have a very long history of being part of a lot of other emergency situations, or at least the relief response to that, particularly with cyclones. Can you tell us about some of the differences in terms of responding to cyclones and responding now in a health emergency, in a pandemic?
So for any sort of crisis, including natural disasters, Save the Children has core commitments on protecting children, so child protection, ensuring that children are kept safe, their health and well-being, as well as education, also, livelihood and food security. So we have been responding to various tropical cyclones, TC Harold, TC Yasa, and TC Ana. And then we have had COVID on the heels of TC Yasa and TC Ana. So it has been really challenging. The main challenge is the fact that, during a pandemic, we have to be extra vigilant about our staff safety and security, especially because we are dealing with a life-threatening virus, a virus that's killing a lot of people, and unfortunately, a lot of people have passed away. So it has been, challenging in terms of being able to make that decision and take the risk of deploying our staff into the communities, while at the same time being able to deliver on our core commitments and be able to serve the families that are also depending on us.
Thank you, Shairana. I'm going to come back to you again later in this dialogue, and I just want to thank you again on behalf of all of our viewers listening in right now. I can see that there are quite a lot here on Zoom, and I'm looking at all of you tuning in as well via the Save the Children New Zealand Facebook page. Thank you for your time. I am going to invite Heidi up next, but before I do, I just want to remind all of you at home, particularly our family out there and our friends out there in New Zealand, thank you for your support. And to those of you who are at home right now, we're going to be putting up, if you don't have access to the Zoom platform, we're going to be putting up information on how you can donate, because the work that you're doing, the support that you're giving is crucial to the work that people like Shairana and her team are able to do. So I'm just going to invite Heidi to join us now. And Heidi, please, Vinakavalevu for your attendance tonight, and tell us about why you think Kiwis want to support this cause.
Bula Vinaka and kia ora, everybody that's at home tonight. No better place to be, I suppose, on a night like tonight. We've been absolutely humbled by the incredible support from the people at home, not only by the donations that they've made, but also by reaching out with messages of encouragement and messages of support for our work. Kiwis have a very special relationship with Fiji. Many have family in Fiji, others have visited the beautiful islands. And up to recently, Fiji has done very well at keeping the virus at bay, but sadly, this is no longer the case. And as we saw the cases go up, Kiwis wanted to know how they could help. And so the appeal was born. The impact of COVID-19 has been significant for children in Fiji and across the world. This virus risks us turning back all the good work we've done for child well-being over decades. And so with a fantastic team like our Fiji team that we have been partnering with for probably the last 25 years, we've been able to respond to this humanitarian crisis. And we've also been able to work with the team on other projects funded by the New Zealand Aid program. And we all have to learn now how to adapt to this new environment.
Thank you, Heidi. Just before we move on, I've just seen notification of questions being sent directly. And sorry, my apologies for switching off the video a little bit. Needed to look at the chat feature to see a wonderful feedback coming in from our friends here in Fiji and there in New Zealand. And there was a question for Shairana, which I'm going to ask her to answer now because it leads into conversations that we can continue to have now. Heidi. And so, Shairana, the question was, how do you decide who to help, considering there's so many people who need the help of organizations like yours?
Thank you, and thanks for that question. I think, especially during COVID, it's very difficult to verify and vet, the beneficiaries, the families that are asking for assistance. We have a criteria. We are prioritizing assistance for single mothers, mothers that have given birth recently and have newborn babies, the elderly, those living with disabilities, the ones who are more vulnerable from the most vulnerable populations in Fiji. And of course, those who are unemployed and have lost their jobs basically because of COVID. So that is our criteria, and our priority is to help those families, and especially families that have children. So we prioritize those families before we are able to attend to the other, families that are also requesting for support.
So what happens to the other families that you can't help right then, Shairana? Are you in touch with the other CSO communities? Tell us about what happens to them while we're trying to get support from our friends in New Zealand to give you more resources.
Yeah, so far, to be honest, we have been able to assist every request that we have received. And again, I want to reiterate that this has been made possible because of the generous donations we have received from the New Zealand public, also from local donors here in Fiji. And we would like to assist everyone because if you look at the situation here, absolutely everyone is affected. There are so many families that were doing pretty well before the pandemic, and now they have lost their jobs, they have exhausted all their savings, and they have nothing really left to be able to purchase food. So far we've been really fortunate, but we also have really good partnerships with other CSOs, that are also providing us support to families, particularly in the Central Division. We are coordinating efforts with the National Disaster Management Office, and also the commissioner's offices. So that coordination is there, and we are sharing our data with them. They are also sharing information. The NGMO has done some vulnerability mapping, and they've gone to the various, vulnerable communities, and they have really good data on who needs support. So we are depending on that to be able to prioritize support.
Thank you. Shairana, I'm just going to ask you to think a little bit about the other kinds of support aside from food, that while I answer a question that's just come through. And I just want to remind everyone that's listening in right now that they can help with the emergency situation here in Fiji. Please donate by clicking on the link in our chat that's just come up right now. And for anyone just joining in, we're taking questions from you at home. We'd love for you to join the Zoom link so that you can provide the questions in on there. Otherwise, put them in the comment section, and hopefully our tech team will be able to see that and flick it across to us. Otherwise, there's a question that's come through from our friends in New Zealand asking about vaccine rollout, the vaccination rollout. How is it going? And also a supplementary question to that: is vaccine hesitancy getting better? Is it going away? So very quickly, our vaccination rollout program is one of the things I like to talk about a lot, because that's where all of the good news, or at least a lot of the good news in this particular response has been. We have, if I'm not mistaken, I need to look very quickly at the figures after this and reconfirm to you, but we now have more than 90% of the target population who have taken at least one dose of either the AstraZeneca vaccine or the Moderna vaccine. And we've had 32%, if I'm not mistaken, or more, who have now been fully vaccinated with either one of those two vaccines. Now, our government is in negotiations with the United States government and manufacturers of the Pfizer vaccine, which, as I'm sure some of you know, is the vaccine recommended for children between the ages of 12 and 17. So very relevant for this conversation. And that new vaccine should be coming out soon. So as for your second question about whether or not vaccine hesitancy is improving, it most definitely is. Dr. Rachel Devi, the head of the Ministry of Health's vaccination rollout program, told us that their figures of the past 3 weeks or so have shown a huge increase. 2 weeks ago, they saw 90,000 more people come in 1 week than they had in the week before to receive their vaccines. And so a lot of that is because, as Shairana pointed out, there's been a lot of work, there's been a lot of partnerships with governments, with CSOs, and of course, with just members of the community, reaching out to people in the rural area to raise awareness as to the critical nature of this vaccine, particularly when here in Fiji, that is our main strategy to address this crisis. So thank you very much to our friends in New Zealand who sent us that question. And so, Shairana, the next question I have for you now is to do with the mental health impact of this crisis, the impact on children. Can you tell us about that?
Yeah, thank you, Lice. Mental health is one of the areas that I feel we have not really responded to very well, because there has just been so much focus on just meeting that immediate need of food. And I think there hasn't been a lot of attention in the country around, how COVID-19 has impacted families, just in terms of their psychosocial health and well-being. So in terms of children and their mental health, we do know, and this is based on the observations that we've had and just the work that we're doing in the communities. So based on those observations, we know that children are tired. They are also frustrated. They have been at home for months. They're not going to school. Parents are quite, their priority now is to be able to put food on the table. So they're not really able to focus a lot on learning within their homes and ensuring that children are actually, focused and learning during this lockdown period. There are also issues where there is a lot of pressure on families right now, and there is, as you know, there is increasing cases of violence within homes, domestic violence cases. If you look at the stats from the Fiji Women's Crisis Center, just the number of calls that they've received from families asking for help, that has gone up significantly during this period, and that does have an impact on children and their well-being. So it has been quite significant. But the other issue here is just around, families losing loved ones to COVID. And, we know that the more vulnerable, families, particularly the elderly who have, passed away. And we know that children are very close to their grandparents in Fiji. And that I can say that, just based on some of the discussions I've had with some of the families, this has impacted children, to a great extent, because they've lost, people they have looked up to all their lives. They have a close bond with, their grandparents, and that has really affected children as well. Just, losing people suddenly. So that has, that's a key concern, and it's going to have a long-term impact on children and their well-being.
Shairana, I just want to expand a little bit on that because you're absolutely right. I've had conversations with Shamima just in the past a couple of days over at the crisis center, speaking exactly of that information you've just given. The outgoing Minister for Women, Mercedes Buniwanga, pointed at that same thing towards the end of last year after research done with other CSO partners. And Selina Kuruleva, a leading mental health expert here, spoke about it, and she called it the silent epidemic, the mental health impact. And so it worries me. I am first very encouraged that Save the Children is paying attention to the mental health of children, especially the mental health impact on children. And I must praise you for that, because I have not heard it spoken of in that way. Thank you. But what do we do going forward? These funds we're trying to raise with the Feed Fiji campaign, or do you have other programs going on with other partners, or what is the plan? Has the CSO community started conversations around the mental health impact to children, at least?
Yes, and just to answer your question on that, there is a safety and protection cluster, which is chaired by the Permanent Secretary at the Ministry of Women, Children and Poverty Alleviation. And so the focus of that the cluster, during crisis, is to look after protection of women and children and their health and well-being. So we've been meeting. We are a stakeholder. There are other civil society organizations that are also are members of the cluster, and we've been meeting regularly since the second wave hit. And we've been, discussing contingency plans in terms of how do we support families, especially around, protection issues, ensuring that there is psychosocial support and counseling, as well as, addressing the needs of women. So at the moment, there are several organizations that are providing counseling. You would know Empower Pacific is very active, and they're also a partner that we have partnered with in the Western Division for the grocery pack distributions. We are actually, our role is referrals. So as we receive requests from families, we are referring them to the Child Helpline, to the Medical Services Pacific, as well as Empower Pacific and the Child Services Unit for further support and guidance. So that is what we have been doing so far. And yes, we have noted an increase in the number of cases that have come in, just asking for support with everyday issues, counseling, to be able to, assist with them with that.
Thank you for that, Shairana. I as a mom myself, I think we're all kind of quickly wishing we had some counseling experience, because having children at home for so long away from school is a struggle in itself. And so I'm going to ask Irene to join us at this point, because as I understand it, Irene's been working a lot in the space of the impact to children's education. Irene, thank you very much much for waiting while we went through the other panelists. Please join us now and tell us about the impact that COVID-19 has had on children's learning here in Fiji.
Thank you, Lice. Good evening, everyone, and Bula from Fiji. As you all know, that schools remain closed in Fiji, and definitely COVID has caused a shift in the normal face-to-face classroom-based learning to the more home-based or remote learning. So what is happening with the student teaching learning is that Ministry of Education is working tirelessly in providing education resources to students through these schools. So teachers are preparing worksheets for these students, and they are handed out these worksheets. And they are also learning materials being uploaded online, and some certain schools are using Moodle and other online platforms like their Facebook pages, or the teachers have their own groups, survivor groups for their students. And this is one way that they are continuing learning for the students. And the ministry is, we should commend the ministry, I would say, that they are continuously trying their efforts, their best to keep this going. And they're also providing support to these schools in terms of resources. So worksheets can be printed where students are not able to receive or reach out to the online platforms. So yeah, I mean, that's what's happening with the continuity of learning with the students.
Irene, can you tell us, do you have any idea what percentage of the student population, what percentage of children who are at home are actually able to receive this online learning delivery that our teachers are now providing, and how many aren't? And can you give us a little bit of an explanation around the efforts that are being made to reach those people, particularly those who may not have connectivity or devices, just the availability of devices in their homes?
Yes, so at the moment, there is about 60% of the teachers that are able to use online platforms to reach out to the students. And this does not mean that there is stable and proper connections, but this is sometimes intermittent connections. But what we have heard is about at least 60% have these, and then the others are like about 25% that that still use these print forms. Majority of them are receiving worksheets. While the teachers do have internet connections, students are either at their own homes or they have moved from their normal place of residence. So some have gone back to their villages, they have gone back to the islands. So the normal place of their stay has shifted. So it's a bit difficult to reach out to students. So what is happening at the moment that these are the various platforms that students can have access to the worksheets. So where you are not able to receive or access it through online platforms, then parents can come to the schools to collect these worksheets. And if parents are having challenges, as we have heard that it's very hard to put food on the table, so some do not have bus fare or transport to come and collect these from the schools. So the schools are reaching out to the students or to their parents, and most of the students are living in villages as well. So the teachers or the heads of schools are reaching out to these Turangani chorus or the village heads, and they drop off these worksheets to the villages, and then it is disseminated to those students. And in other cases, then the parents reach out to them. Sometimes they are able to come and collect it, and sometimes they're not able to. So there is communication between the teachers or the heads of schools and the parents, and they always reach out to each other to check on how they're doing. And if the teachers are noticing that parents are not coming to collect the worksheets. They get in touch with them, and where possible, they are issuing like 2 weeks of worksheets. So usually this is a weekly thing. So yeah, that's how it is at the moment.
Thank you, Irene. I think that's been one of the most thorough awareness I think I've had, at least of the work that the government is doing through the Ministry of Education to reach our children. I'm wondering, how are you able to monitor and evaluate the efficiency of these awareness programs, given that we know families are struggling, we know that we're at an all-time low in terms of employment, we're at an all-time high in terms of people's inability, in terms of poverty. And so with people unable to put food on the table, how are they able to afford electricity and internet, and how are they able to to have their children able to study in these times? Do you have programs as well running alongside your food programs to ascertain learning at home?
So in terms of monitoring students learning at home, or having access to these resources, we Save the Children is not at the moment doing it, but the ministry had activated this national education cluster, and we are partners to that cluster. We are part of the cluster, and Save the Children being co-lead for this education cluster in Fiji. We are supporting government in the COVID response, contingency and response plan for the education sector. So that is currently being discussed and finalized. And in there, we have a monitoring and evaluation section that will sort of gauge how students are actually coping with these resources, and how many are benefiting, and where we are, and how we can make improvements. So at the moment, it is the teachers who are keeping track on how these students are performing. So when worksheets are issued, or if they are conducting online classes through Zoom or Google Classroom, so they sort of have their own data, and the schools will have access to this, and then they report to the divisional or district offices, and then MIHA, gets this information from them. So there are plans in, checks and balances in place on to ensure that student education continuity is maintained.
Okay, I'm really grateful to hear that, because I'm sure I speak for all of the parents in this country when I say that it is not easy to be parent and teacher and counselor and disciplinarian all at the same time. And I only have two, but just providing them with the devices and now triple the data plan that I would normally buy to make sure that they continue with learning. Thank you for that update, Shairana. I'm sure that the work that you're doing to support children's learning along with the grocery packs must be a lifeboat. I'm going to, at this point, just remind all of our friends tuning in here in Fiji via the Facebook page for Save the Children New Zealand, and those of you who have registered and are part of the Zoom conversation and sending us those questions, thank you very much. I am getting them from the wonderful tech team over at Save the Children New Zealand. I'd just like to remind you that you can continue to donate to the Feed Fiji campaign and support the work that Save the Children is doing to put food on the table in Fijian homes. Now, we've got a few more questions that are coming in, and some that are on my table right now, so I'm just going to very quickly look through them. But while I do that, Shairana, or maybe Irene, do you have any thoughts of what do you think life will be like for children once the country opens back up? I'm not going to ask you to predict when, but how is it going to be for children coming back with this kind of intermittent or distance learning that they've gone through for the past 4 months now?
Yeah, I think students or children have sort of transitioned into this new norm. No, this is a new normal for them now, and it's been 4 months, yes, and they are sort of getting used to it, or they're adjusting to this remote learning. It is challenging, definitely, because students, children, when they are at home, they are distracted in some form, as compared to when they're in a classroom-based setting. So it is, I guess, when they go back to school, it will be a different scenario, and but there are measures in place the government is doing, like to ensure that these schools open, and they make sure that it is safe. It is they have a safe environment for the students when they go back to school. So yeah, definitely it will be a a change after so many months, but because they are encouraged to continue studying at home, I think that pace is already set. So it's just the going from home and into a classroom-based setting. But because they continuously have interactions with schoolwork and with the teachers, those who are are able to have these online sessions with the teachers, so that sort of connection is still there and communication is still there. So yeah, it will be different, but I think after a few months they will settle.
Thank you, Irene. And did you say that there is monitoring and evaluation planned for the learning that children have done, and maybe the work that needs to be done when they return to classrooms to bridge the gaps that may exist?
Yes, under the COVID and the contingency response plan for Ministry of Education, there is various ways to monitor on how progress is being made, and teachers are trained to cope in this situation. So their professional development is also enhanced that way, and there will be also training for the heads of schools and the district education leads to ensure on safe school operation guidance. So those things are being planned at the moment, and that they will execute this in the coming months, so that we ensure that everything is done for the students and their learning is maintained.
Thank you so much for that, Irene. I'm grateful that you answered all of my questions with regards to children's learning. I want to, at this point, thank all of the people who have started to donate so far. I've just found out from Amy and the team at Save the Children New Zealand that donations have started to come in. And we now have, right at this moment, in the 40 minutes or so that we've had this Talanoa, we've raised enough money to feed 10 families for 1 week. And so thank you, Vinaka Valebu, for your generosity, and thank you for believing in the work that Save the Children is doing there in New Zealand and here in Fiji. Irene, thank you very much for your time. I'm just going to ask Shairana to join us again and ask us and tell us about the kind of support, the kind of work you're able to do with the money that's come through now from this Feed Fiji webinar.
Thank you, and I do want to thank everyone that is watching for your generous donations. As I mentioned, every dollar counts at this stage, and so the funds that has been raised will help us purchase grocery packs. Each pack costs about 100 Fijian dollars. And will last a family of, say, 4 to 6 family members about a week or 2 weeks. It has got basic food items, flour, rice, milk. There would be things for the babies as well, milk, diapers, or napkins. There would be things like, cereal, as well as, soap and mask to ensure that they are safe as well. So everything that is every money that is donated right now will help to purchase grocery packs and be able to meet the needs of the families that are requesting for assistance. So Vinaka Vakalevu for that.
Thank you, Shairana. Shairana, when things reopen, it's going to take, economists are saying, it's going to take a while for those industries that support our economy or that hold up our economy, like tourism, for example. It's going to take a while for that to get back up, and for other industries that support the livelihoods of Fijian families. What are you looking at, going forward? What are you looking at in terms of the work that you're doing, the money that you will require to do that work, to continue to put food on the tables of Fijian children?
I think we can, going by the fact that our borders are still closed and we are very much heavily dependent on the tourism sector, and that majority of the people who have been affected right now are employed in the tourism and related retail sector. These families will need assistance for the next several months until the borders reopen. So I believe that, we still would be focusing on providing them with basic food items. But we are also working with, our colleagues in Save the Children New Zealand and also, other partners here in Fiji to ensure that there is long-term food security. So there are existing projects that we have in some of the communities just to ensure that, we are able to support families with, say, seedlings, for example, so that they are able to plant and, are food secure in the long term. So we think that we will be able to scale that up. Also, we are looking at, providing additional grocery packs to these families as more funds are, mobilized. So we expect that we will keep supporting these families for at least the next 4 to 8 weeks, or at least the next 3 months.
Shairana, one question that's continued to come through this entire Talanoa from the very beginning, and I must say thank you to the people posing this question, is how can people support your work in kind? How can people volunteer to be part of your team of people out there for children?
Thank you. Just in terms of volunteering, the time and resources to save the children, we do have a process in place. So we would appreciate if you are able to email us your applications if you're interested in volunteering. The details are on our website, and we can share those details with our colleagues at Save the Children New Zealand as well. Also, we would benefit from advice as well. Also, we would benefit from resource mobilization efforts. So I think, if there's any skills, anyone that has skills to be able to raise funds, that would be useful. So again, please reach out to us and we'll see how we can, work together with anyone who is interested.
Another question, Shairana, sorry, it's not the last one yet, but we are nearing the end of this Talanoa. So a quick thank you to everyone that's been listening in. And if you have burning questions that we haven't yet answered, you still have a tiny bit of time to put that through. But Shairana, there's been some research, there's been some news coverage at least of possible long-term setbacks to children who are coming out of lockdowns, who are coming out of the pandemic in general. Do you see that happening here in Fiji? Is this something that's already on your radar? And what's your preliminary work to address that?
I think we can certainly learn from the experience of the other countries, in terms of how this pandemic since last year, since it began, it has affected, children. And I think one of the immediate concerns for us is Save the Children is just around children's ability to continue learning. If things go back to normal, there's still quite a lot of catching up to do. And our worry is around children who are, in say year 13 and are supposed to transition into tertiary education. So one of our concerns is how will the government or tertiary institutes address that, because there are no examinations yet, and assuming that they're not able to sit for the exams, does that mean that they are supposed to resit and they lose out on that 1 year? So these are some of the concerns we have. And I think the immediate concern is just, that children, yes, they have been learning at home remotely, but we know that, in a classroom setting, it's completely different. So how do they catch up on that? And that will have some stress on the children themselves. So again, we know children learn differently. Some are quick to catch up, others are not. And so we are hoping that we can support the ministry to really, tease out these issues and have plans in place to support children for their learning, once we come out of this pandemic, hopefully soon.
That's a very valid concern, Shairana. I think I speak for the parents of every single 16, 17, 18-year-old right now. Everyone is worrying about that, and I'm grateful that you were in that cluster, the child protection cluster, which the government runs, and therefore able to tease out these issues, as you put it. Thank you for that, Shairana. Now, the last question that I have for you, that's also come throughout this Talanoa. Thank you to people who have been asking this question. Now, how does a less fortunate child or a child who is in need of your grocery packs right now, or any of the other assistance that your organization provides, how can they qualify? Is there a system of registration? Do people have to register their interest with you? How does that work?
So at the moment, we have just been directing people to our Facebook page. We do have, a Facebook page, Save the Children Fiji, and people have been messaging us through that page, and we are, receiving requests and entering it into a database. But the other way that people can reach out to us directly is through our office number. So please, now we are open. We do have some staff who are working in small bubbles at the office, so people can call us on our office number and just let us know of their details, and we will be able to support them.
Thank you so much for that, Shairana. I'm just going to be naughty and ask you, what is your office number for people who might be listening right this moment and would like to note it down?
So it's +679 3313 178.
3313178. For those of you listening in here in Fiji, it's 3313178. Add 679, the country code before those numbers, if you are joining us from overseas. Thank you so much, Shairana. Do you have any parting remarks that you'd like to make, an appeal maybe?
Yeah, again, thanking everyone that has been watching us this evening, and on behalf of Save the Children and our colleagues in New Zealand as well, a big vinaka vakalehu for all the support that you've given us so far. We are extremely grateful for that support, and it has allowed us to do this work so far, and we are looking forward to your generous donation to be able to continue the work for the next few months. Vinaka.
Vinaka valevu, Shairana. I'd like to say vinaka as well to Heidi and to Irene for your contributions to tonight's Talanoa. Thank you as well to Amy and to our dear friends who you can't see, but who are definitely there and have made sure we've stayed online despite all of the pressures on the bandwidth here and there in lockdown, New Zealand. And thank you so much to everyone who have been part of this Feed Fiji campaign. But thank you especially to those of you at home watching from the North and South Island of New Zealand, from Aotearoa. Thank you for your generosity. Thank you for your interest in what's happening here in Fiji and in supporting the families and the children through the work of Save the Children Fiji. Thank you to those of you joining us by this live stream on the Facebook page. Vinaka Bailevu for your questions. Vinaka for being interested in this work and therefore supporting it. For those of you who are not able to donate tonight and still would like to contribute to the Feed Fiji campaign fund, funds. You can do that still, and the donate link is still valid, so you can do it even after this webinar is done. But if you have any questions, you could send them through on the Save the Children New Zealand page that you're watching this live stream from, or on Save the Children Fiji, as Shairana has pointed out. If you need email to send questions to, you can send that to info@scnz.org.nz. So that's info@scnz.org.nz for Save the Children New Zealand. So on behalf of everyone here who have been part of this Feed Fiji webinar, I'd like to say Vina'a, Valevu, and thank you so much.